Equine genetics and breeding genetic disorders, identifying and managing genetic disorders in horses and breeding programs. Genetic disorders are conditions that are caused by abnormalities in the genetic material of an animal, including horses. Identifying and managing these disorders in breeding programs is essential to ensure the health of the horses and the viability of the breeding stock. There are several ways to identify genetic disorders in horses, including genetic testing and exam by a veterinarian trained in equine genetics. Genetic testing can identify carrier animals, which have the genetic mutation but may not show symptoms of the disorder, and affected animals, which will show symptoms of the disorder. Since not all genetic disorders have a genetic test available, close observation and genetic family history can also be employed in identifying the risk factors. Once a genetic disorder has been identified within a breeding program, management options may include avoiding mating carrier animals within the same breeding program. Testing and selection of breeding stock can be used to eliminate a genetic disorder within a few generations. Breed registries and standards can also mandate testing as part of their responsible breeding practice. Overall, it is essential to know of the genetic risk factors for your horse breed, to identify at-risk horses, and to responsibly manage breeding programs to prevent the spread of harmful genetic disorders. Sure, I'd be happy to provide you with more specifics about genetic disorders in horses and how to manage them in breeding programs. First, it's important to understand that there are many different genetic disorders that can affect horses. Some examples include 1. Hyperkalemic periodic paralysis, HYPP, a genetic condition that affects the muscles and can lead to episodes of paralysis. 2. Polysaccharide storage myopathy, PSSM, a genetic condition that affects the way horses store and use energy in their muscles. 3. Lethal white syndrome, LWS, a genetic condition that affects the production of pigment in horses, leading to lethal digestive system defects. 4. Hereditary equine regional dermal asthenia, HERDA, a genetic condition that causes the skin to be fragile and susceptible to tearing and scarring. Once a genetic disorder has been identified, the first step is to determine whether the disorder is dominant or recessive. Dominant conditions will be seen in horses that have just one copy of the gene, while recessive conditions will only show up in horses that have two copies. In the case of dominant conditions, it is recommended to avoid breeding any horses that carry the gene. For recessive disorders, breeding two horses that each carry one copy of the gene will result in a 25% chance of producing an affected foal. Therefore, it's recommended to test all potential breeding horses and only use those that do not carry the gene. Some ways to manage genetic disorders in breeding programs include 1. Genetic testing. Many genetic disorders can be identified through DNA testing. This will allow breeders to identify carrier animals and avoid breeding them together. 2. Pedigree analysis. Examining the pedigrees of potential breeding horses can help identify whether they are likely to carry a genetic disorder. 3. Breed registry regulations. Some breed registries have established rules and regulations regarding genetic testing and breeding practices that may help reduce the spread of genetic disorders. 4. Open communication. Breeders should communicate openly and honestly with one another about any genetic disorders that have been identified within their breeding programs. Sharing this information freely will help the entire community of breeders work together to manage genetic disorders and reduce their impact on the breed. Overall, responsible breeding practices that involve proper genetic testing, pedigree analysis, and communication can help greatly reduce the prevalence of genetic disorders within horse breeding programs. Pedigree analysis is the process of examining a horse's family history to identify potential carriers of genetic disorders. Through pedigree analysis, breeders can identify horses that may be carriers of a genetic disorder and use this information to make informed breeding decisions.